Earth is regulated by the spleen and stomach, and metal is regulated by the lungs and the large intestine, and the water is regulated by the kidney and urinary bladder. And two pair of organs, one is liver and gallbladder, and heart and or intestine. We discussed yesterday, and today we will discuss about the pancreas, spleen, and stomach. And these organs are earth element organ, and these organs are the balance organ and center organ. In the five element, two elements are wood and fire, and two elements are metal and water. Okay, so wood and fire are the hot element. Okay, and water and metal are the cold element, and earth is just a balance element. Okay, so if we clear to earth, okay, then our body will be balanced. Today we will discuss about the earth element, and organ is spleen and stomach. My my screen is visible.
Yes, it is.
Spleen is an organ located in the upper left part of the abdomen, the next to the stomach, and it is an important part of the immune system and plays a role in the filtering and removing the old or damaged blood cells from the circulation. The spleen is responsible for the transforming food into the vital energy and blood, as well as controlling the body's water metabolism. And
Okay.
test related to spleen is sweet. If you like more sweet, or if you have more craving of the sweet, means your spleen required your health, or your spleen energy is being low. And emotions of the spleen is overthinking. When your spleen will be in low energy, you will be full of the thoughts. Okay, you will thought every time, and your thoughts will be like spiral thoughts. And the sensory organ for the spleen is your mouth. If you have any mouth ulcer or dryness in the mouth, means your spleen, and if there is any mouth ulcer, means your spleen energy is excess, or your spleen function is in hyper condition. The emotion of the spleen is overthinking, and the tissue of the spleen is the muscles. When your spleen will be weak, or your spleen energy will be weak, in that condition, your muscles will be weak, and you will feel tired easily, and there is a lot of chances of the hernia, because there is more chances of the tearing of the muscles, and your muscles will be weak if your spleen energy is in deficiency. Some other common disorders of the spleen is, spleen is the one of the most common disorders of the spleen is, it can be caused by a variety of the factors including poor diet, excessive worry, overthinking, overwork, fatigue, bloating, loose stools, poor appetite, prolapse of rectum is because of the spleen, and the uterus or stomach, and fatigue, heavy sensation in the limbs, edema, greasy tongue, and pale complexion, dizziness, palpitation, and irregular menstruation in women. These are the hypofunctions of the spleen. And color of the spleen is yellow. So if your eyes is yellow, stool color is yellow, urine color is yellow, skin color is yellow, means there is some disorder of the spleen.
Okay.
And excess energy of the spleen or hyperfunction of the spleen. When a spleen is overactive or hyperfunctional, it may be lead to symptoms such as bloating, poor appetite, loose stools, fatigue, and feeling of heaviness in the chest. Okay. And splenomegaly, this is the condition where the spleen becomes enlarged, and it can be caused by many different underlying conditions such as infections, liver disease, and blood disorders. Splenic infections, that is the rare condition where the blood supply to the spleen is blocked, causing tissue damage and sometimes rupture in the organ. It can be caused by blood clots, infections, or other underlying conditions. And spleen abscess, this is a rare condition where pus accumulation in the spleen, often as a result of an infection or injury. So, this abscess is because of the liver, because liver controls to spleen. So, and spleen injury, the spleen is vulnerable to injury in the certain situation, during the trauma as a result of a medical procedure, or any an injury to the spleen can cause bleeding or other complications. And male partner of the spleen is the stomach. So the stomach is considered an important organ that is responsible for receiving and digesting the food and fluids. The stomach is also closely related to the spleen, which is responsible for transforming blood and food fluids into the energy. And your stomach is not only digesting the food, the stomach is not only digesting the food, your stomach is digesting too your thoughts. Okay. So your stomach is digesting your thoughts too. Okay. If you are in more stress or overthinking, it will directly affect on your stomach, or it will affect on your digestive system. on your stomach. Okay. So especially at the time of food, when you intake the food, lunch or dinner, okay, at that time it will be better just close all the things, all the devices, all the mobiles, and just maintain the peace and eat healthy food peacefully. If you are consuming, you are eating very healthy food, but your mind is in your patient, in your business, or in your any other condition. If your mind concentration is not on your food, definitely your food will not digest it. That's why in India, number of patients are consuming the medicines for the gastric problems or like that pantoprazole or other medicines. First thing, when consume the food, please stop all the activities. It is very important point. And point number two, the mother of spleen is heart, or mother of earth is fire. If fire is more, then easily you can digest the food. Okay. So fire color is red color. At the time of consuming food, if you see the red color, it will directly affect on your digestive system. So at the time of lunch or dinner, you can uh, cover your table with red color of cloth, or you can light red color lights. It will be helpful for your digestive system. And cold food like cold water and ice cream, cold drinks, and any cold things is enemy of your stomach. Actually, your stomach like heat. Stomach likes heat, but when you consume the cold drink or cold water, in that condition, heat will be reduced. So it will difficult to digest the food for the stomach. So if you are friendly with your stomach, please don't consume uh, cold drinks or ice cream or cold water after the meal. Okay. So there are three things. One, take food in a peaceful mind and peaceful place. Okay. Don't disturb at the time of food. Number one. Number two, red color cloth or red color light at the time of food. Number three, no cold drinks, no cold water after food. These three things can help your stomach. Okay, and
Yes, sir.
there are some common disorders of the stomach. First is the hypofunction of the stomach, means if the energy of stomach is low, or energy of stomach is low, means the fire is not giving proper energy or fire is less in the body. Because of that, the energy of energy of stomach may be low. So in that condition is called hypofunction. In this condition, this occurs when the stomach functions of transforming food and transforming energy is weakened, and symptoms may include poor appetite, bloating, loose stool, and fatigue. And second condition is stomach heat. It occurs when the stomach function is of regulating the body heat is impaired, leading a buildup of heat in the stomach. Symptoms may be include bad breath, bitter taste in the mouth, dry mouth, constipation, and acid reflux. It is the hyperfunction condition of the stomach. Stomach coldness. This occurs when the stomach function is warming and transforming food is impaired, leading to a buildup of coldness in the stomach. Symptoms may include abdominal pain, diarrhea, and lack of appetite. Stomach dampness. Stomach dampness is often associated with the dietary factors such as eating too much damp, producing foods for consuming food or drinks that are too cold or too sweet, as well as exposure to damp or humid environments. When dampness affects the stomach, it may lead to symptoms such as feeling of fullness or heaviness in the abdomen, loss of appetite, nausea, vomiting, diarrhea, or loose stools, and a thick or greasy tongue coating. And next organ, which is very closely related to your spleen and stomach, that is the pancreas. We consider pancreas in the earth element. So the pancreas is a gland located behind the stomach that produce enzymes to aid in digestions and hormones such as insulin to regulate the blood sugar level. Common diseases of the pancreas, hypofunction of the pancreas is responsible for producing the digestive enzymes and hormones that regulate the blood sugar level. When the pancreas is hypofunctional, it may lead to symptoms such as poor digestion, bloating, fatigue, weakness, and fluctuations in the blood sugar levels. Hypofunction of the pancreas may be caused by factors such as poor diet, chronic stress, physical inactivity, or genetic predisposition. And if the hyperfunction of the pancreas, if your pancreas is hyperfunction, so it is referred to as a pattern of disharmony where the pancreas is overactive or working too hard. The pancreas is responsible for producing the digestive enzymes, hormones that regulate the blood sugar level. When the pancreas is hyperfunctional, it may lead to symptoms such as excessive thirst, frequent urination, hunger, fatigue, weight loss, and fluctuations in blood sugar level. And next disorder is pancreatitis, an inflammation of pancreas and can be acute or chronic. Acute pancreatitis can be caused by the gallstone, alcohol consumption, or certain medications, while chronic pancreatitis can be caused by long-term alcohol abuse or autoimmune conditions. And diabetes is a condition where the body is unable to properly regulate blood sugar level. And type 1 diabetes is caused by the pancreas is not producing enough insulin, while type 2 diabetes is caused by the body not using insulin properly. And there may be some cystic fibrosis in pancreas. This is an inherited condition that affects many organs, including the pancreas. In cystic fibrosis, the pancreas produce thick muscles that can block the ducts and prevent digestive enzyme from reacting the small intestine. Pancreatic pseudocyst. This is the fluid-filled sac that developed the pancreas after an episode of pancreatitis. So, main or important thing in 5 elements. I take the decision mainly on the two symptoms. First symptom is the taste craving. Taste craving is very effective and very reliable and very clear system. Other symptoms may be some confusing symptoms, but taste craving is very solid symptom. So there are 5 tests in or 5 element. There are 5 tests. First test is for taste craving. Sour means your liver is in hypo. Bitter test is your heart is hypo. Sweet taste craving is your spleen is hypo. And spice taste craving is your lungs is hypo. And salt taste craving is your kidney is hypo. And in other hand, dislike. If you dislike sour, it shows your liver is hyper. If you dislike bitter, it shows your heart is hyper. If you dislike it, it shows your spleen is hypo. If you dislike spice, it shows your lungs is hyper. Salt. If you dislike salt, it shows your kidney is hyper. So it is self-test. And you all please tell me about your test craving. First, Nanda sir, what is your test craving?
The screen, please, sir.
Your taste is
Oh,
doesn't want
I don't like spice.
no taste craving.
Taste craving, I like sweet.
You like sweet.
Sweet.
Okay.
And
And
then
Vincent sir, your taste craving.
I too like sweet, but spicy also is area.
Like you like sweet, more sweet.
Yeah.
Amina,
Yes,
what is your taste craving? Which taste you like more?
spicy.
Spice.
Sir, myself sour.
Your sour. Okay.
Yes, sir.
Shankar,
Sweet and spices, sir.
sweet and
Yes, sweet.
spicy. Okay.
Yes, sir.
And Madhukar,
sour, sir.
sour. Okay. So which taste you have craving? Okay. Are you feeling any problem related to that organ or not?
Well,
The person who are having more sweet craving, so they are the main symptoms of the constipation, body pain, muscular pain, lethargic body, less energy in the body, like that. Feeling and
well, sir,
pardon,
the spicy, I love spicy things. I'm actually asthmatic.
you like more spicy?
I like spicy and asthmatic in nature.
If you like spicy, means your lungs energy is low, and you have some issues related to your lungs or related to your large intestine.
Okay.
And now, which taste you dislike? Nanda sir,
I don't like spice. Yes, my head will sweat like anything, so I don't like spice.
you don't like spice,
Spice.
or
Yeah.
and you like
Sweet.
sweet. Okay, we'll discuss one by one. So, Nanda sir, you like more sweet. Okay, so it shows that your spleen energy is low. Your spleen energy is low, and you dislike spice. Spice is the taste of lungs. Means your lungs energy is
All right.
more. No? Your lungs energy is more. What is the cause of this lungs more energy? Okay. Lungs are consuming more energy from your spleen. And who controls to lungs?
Heart.
Heart. Fire. Heart controls to lungs. Okay. So definitely your heart energy is low. Your heart energy is low. Because of that, heart energy is low. Because of that, your heart is not controlling to lungs, and it is not giving proper energy to spleen also. Okay. So if you just consume the medicine for the tonification of the heart, don't touch to these organs, spleen or your lungs. Just work on your this small intestine and heart. Okay. And, in electro-homeopathy, there is medicine S1RE, or you can consume fire tea. This single medicine is enough for you.
Thanks.
And
Thanks
by
for the quick
consuming
diagnosis.
this single remedy, you can balance all these organs.
Got it. Very clear.
Yes. And Vincent sir, your taste craving is sweet and dislike is
Dislike is, I don't have a dislike. Bitter.
your dislike is bitter. Your dislike is bitter.
Yes, sir.
Your like is this means your spleen energy is hypo and you dislike bitter means
Yes. Yes.
your heart energy is
Hyper.
hypo. Okay, so in your case there may be two things in your case. Okay, one, your kidney may be reason. Okay, we can find out some symptoms because kidney controls to heart. Okay,
Yes.
and but your heart is hyper means mother is hyper but child is weak. When mother is hyper and child is weak, so maybe someone is sucking more energy. So in that condition, liver controls to spleen. Okay. So maybe in your case, liver energy is high. If the liver energy is high or hyper, in that condition, liver is controlling more to this spleen, and liver is providing more energy to heart. So if we just treat to this organ, liver, okay, it this liver can balance all these two organs. Liver may be the root cause of your this disturbance of heart or disturbance of the spleen. So you can treat your liver. And second cause of your case, maybe the hypofunction of the kidney, because kidney controls to heart. When kidney will control to heart, fire will be low in your body. In that condition, when you will tonify to this fire element, then sorry, earth water element, then fire element will be low, and automatically this spleen function will be normal. Okay, so you can take treatment for your two organ. One is liver, and second one is kidney. Okay, and again we can find out some symptoms that you have some issues related to the liver or related to the kidney. If you have some issues related to the kidney, we will treat to kidney. If you have more issues related to the liver, we will treat to the liver. But we will not touch these two organs. And otherwise, when you speak normally, directly these two organs are reflecting the symptoms. But we are not touching to these organs. We are trying to find out the organ behind these two organs.
Okay.
Right. So the cause we are finding.
I mean, madam, your dislike and like.
So,
So the give a medicine for 25 liver
Or tonifying to kidney.
25 liver and 20.
Or
Sir, previous screen, sir, please.
yes, wait.
And the EH, how to be the EH?
For tonifying to kidney, we have the medicine, simple medicine, S6 and blue electricity. For tonifying the liver, simple medicine S5 and green
S5?
electricity.
S5 and
Pardon?
S5 and
S5,
G.
green electricity.
Yeah, green.
I'll catch you 1 minute. Yes, Amina madam.
yes, sir. Like spice and salty. Dislike bitter
Like spice
and salt.
and dislike
Bitter.
bitter.
Yes, sir.
like spice means your lungs and large intestine energy is weak. Okay. And you dislike bitter means your
Yes.
fire is more, your heart and small intestine energy is more. So in that condition, you have to control the fire in your body.
Okay.
So fire is more in your body because water is less in your body. Fire is more, fire energy is more because water energy is less. Water energy controls to fire. Simply, if you treat this your kidney energy, okay, your kidney energy is weak. Simply, if you treat the kidney energy in that condition, your heart and your lungs or your small intestine or large intestine will be normal. You can just tonify to your kidney only. Only single organ medicine S6B is enough for you.
Okay. All right. Thank you. Noted. Sir, assuming this test you craft for more than one test, like
Pardon, madam?
assuming you craft for more than one test, you craft at times for salt and at times for spice.
I'm not getting your voice. Your voice is very slow.
Okay, I said, assuming you craft for more than one test, you have a craving for salty and spicy as well.
Yes, because your kidney energy and your lungs energy is weak. Okay,
Okay.
so your kidney energy and your lungs energy is weak. You should just tonify to your kidney and it will control to your fire energy. Your fire energy is excess in your body. So when you will tonify to your kidney, obviously the fire will reduce in your body. Heart energy will reduce, and when the heart energy will reduce, then your lungs energy will increase, and you will feel healthy. Okay. And you told me that do you have some symptoms of the kidney, spleen, and heart? Sorry, kidney, lungs, and heart?
Especially for the lungs.
Or earlier you have?
Pardon?
Earlier you have any symptoms of your kidney related issues, kidney energy issues? Okay.
No, I
And
actually
actually, normally we think about that pathological reports or like that. But if the kidney energy is low, and most commonly in 99% of the female, kidney energy is the low.
Okay.
Because the female genital organ is related with the kidney energy.
Okay. Yes. I got noted, sir.
Yeah.
Thank you.
So
Yeah.
definitely your kidney energy will be low. That's why you feel sometimes salt taste craving.
Okay. Understood. Comprehended, sir. Thank you.
All right.
Thank you. Noted.
Yes, madam from BS Prasad, Karda.
Sir, yes, sir.
Yes.
Like sour, sir.
What is your taste craving and dislike?
Like sour, dislike bitter.
You like sour and dislike bitter.
Yes, sir.
So automatically you will like sour because in at the pregnancy time,
Yes, sir.
so there is more consumption of the blood by the body, and liver is on excess work. Okay, so for this reason, every pregnant lady, or if your liver is in compromising condition, you require sour taste,
Yes, sir.
and your heart function is hyper because of the pregnancy, and heat is more in your body.
Hmm.
Shankar sir, what is your
Sir,
taste craving and dislike?
uh, taste is
First we
sweet
should
and
check you.
spice.
We should check
Sweet and,
ourselves, na, then we will check to other.
sir,
No?
sweet and spice is more.
No. Choose one, sweet or spicy.
Shankar, sir. No.
Huh?
For me. And salt and sour is not interested.
Taste craving is
Sweet and spice.
hmm. Yes, Shankar,
Sir,
craving is
sweet and spice.
sweet, and dislike is
Salt and sour.
salt and
Sour.
sour. Very simple. You have these uh, hypofunction or less energy in these two organs. Okay, so your lungs is in hypo condition, and your lungs controls to your liver. Your liver is in hyper condition because your lungs is already in hypo condition, and they are unable to control the liver. That's why liver is becoming hyper.
Yes, sir.
Okay.
Yes.
Second, your spleen is hypo, and your spleen is responsible for controlling the kidney. Okay, but
Sir.
your spleen is already in hypo condition. That's why he is unable to control the kidney, and kidney is being hyper.
Yes.
What symptoms you are finding the hyperfunction of the spleen, sorry, hyperfunction of the liver or hyperfunction of the kidney?
Yes.
Or you have some symptoms
Mm,
except this craving? Any other symptoms you have? Any other problem? You have?
recently, I faced the frequent urination.
Frequent urination.
Yes.
Frequent urination is the hyperfunction of the kidney.
Kidney.
Okay. And this frequent urination is because of the sweet craving, meetha khao.
Yes, sir.
And just take the treatment S2 F1YE strong. Okay. Just tonify to your spleen. When your spleen will be tonified, then it will control to your kidney. Okay.
Okay, sir.
Your kidney controller is spleen.
Okay.
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 For frequent urination, not required to take any medicine for the kidney.
So,
Okay.
okay.
Just work on the spleen and stomach only.
Okay, sir.
Okay.
Okay. Thank you, sir.
I'm trying to give more examples and more explanation to understand the thing practically and easily. You can understand. Madhukar sir,
Yes, sir.
yes. What
Source,
is your
craving,
sword?
craving of source.
Craving of sword and dislike?
Dislike, nothing, sir.
Dislike?
Nothing, sir.
Nothing. Not possible. How
Spicy.
how you can like everything? Yeah.
Spicy.
Spicy. Spice. Dislike. Okay. Clear हो गया. Okay. Now your question is solved. Your craving is sore. Sore is liver. Okay. Means your
Okay.
liver is hypo.
Okay.
Current condition, your liver is hypo. And you dislike spice. Spice is your lungs. Means your lungs is hyper.
Okay.
Your lungs is hyper.
Okay.
Your lungs is hyper means your lungs are controlling the function of the lungs is control lungs controls to liver na?
Yes, sir.
Lungs
Yeah.
control to liver. Already your lungs is in hyper
Hyper.
condition. Lungs is in hyper condition. To dislike spice na?
Yes, sir.
Which taste we dislike means that taste is more in our body.
Yeah.
Okay. Means spice is the taste of lungs. So lungs energy is more. And the lungs energy is more. And the lungs energy control to liver energy. So that's the reason the lungs energy is more and it is controlling more to your liver.
Okay.
Okay. Simple. Okay. So here in your case, your kidney is the child of lungs and mother of your liver. Okay. When in your case, when we treat to the kidney, okay, and we will tonify to your kidney, we will tonify to your kidney. When we tonify to your kidney, in that condition, automatically when kidney will tonify, kidney will consume more energy or disperse energy from the lungs, and it will provide this energy to your liver. Okay, so simply you can treat to with your kidney, and you are, if when you will go in the depth and the history, you are the patient of kidney related issue. You may be the back pain, you may be fear, you may be chronic uh, stress, and you may be some issues in your ears. You have issues in your ears,
No, sir.
itching, deafness,
Nothing, nothing, nothing.
back pain.
Back pain, neck pain is there. No, no back pains.
Neck pain is there, na?
Neck
Means
pain is there.
pain related bone,
Hmm.
bones pain, and fear or extra precaution. Okay.
Yes, sir. Yes.
You may be in fear or you may be in extra precaution.
Okay.
Actually, normally, no one accept this thing that he is in fear.
Yes, sir.
If you are in fear, you may be in extra precaution, like you are checking lock many times, you are counting notes many times, you are not providing to bike to your son, like that. These are the symptoms of the fear.
Examples. Okay.
Okay. So just you can treat yourself with this only single medicine as 6 below electricity.
Okay, sir.
It will be very useful for your all the symptoms, because your liver is in hypo condition, you are feeling less hunger and fatigue, low hemoglobin maybe. Okay, so all the liver related issues or all the liver related symptoms you have. Okay, but we
Okay.
are not going on your symptoms,
Hmm.
liver symptoms. We are going on your, we are treating to your root cause. We are trying to find out that your root cause. So as per my observation, okay, just only these, only on the basis of these only two symptoms. Okay, there are other things too, but today we are discussing only on these two symptoms. If you tonify your kidney, definitely you will get good result.
Thank you, sir.
So if our spleen is hypo, we treat two organs. One is main organ, that is spleen, and second is mother organ, that is who is the spleen mother? Heart. Okay. For this purpose, we have the medicine for spleen. spleen is hypo, first we tonify to core organ, that is spleen. Okay. For this, we have the medicine earth tea or S2F1YE. And second, tonify to mother organ. That is spleen mother is heart. Medicine for heart is fire tea, or you can use S1, A3, and RE. Second example, if your spleen is in hypofunction, it is in hypofunction. So if your spleen is hyperfunction of spleen, first sedate core organ, means sedate to spleen. The medicine is earth tea, or in 5 element, sorry, in spagyric, S2F1YE, lighter. Second medicine, the liver is the control organ of the spleen. Control organ.
Sir, earth sedate करो. Earth T or earth S, sir?
Sorry, SS. Sedate. And 25 to control organ. Control organ is liver. Okay. For the medicine is good P for liver, and S5 G strong for liver. Now, what is the treatment for hernia? What is the treatment for hernia? In hernia, liver is in hypo condition. Na? Just use this now. Hernia, low anorexia, low appetite. Gastritis, diabetes, mouth diabetes, and in hyperfunction of spleen, maybe mouth ulcer, and frequent urination, here in muscles weakness, just try to find out that which organ is in deficiency, which organ is positive organ. In my practice, I use maximum strong dilution. In very rare case or in some emergency case, I use the lighter dilution. I never sedate to organ. Just I check the control organ or just tonify to control organ. Because sedation is a bad job. And tonification is a good job. Try to check that which organ is hypo.
Sir, only for spleen or any organ, sir?
Pardon?
Only for spleen or any organ?
Not only for spleen, for all the organs.
Okay.
For example, if your heart is hyper, okay,
Okay.
your heart is hyper, I never try to suppress the heart or to give any sedative medicine to heart. Okay, just I give the medicine, control organ medicine. Who is the control organ? Control is the kidney. Kidney controls to heart. Just I only tonify to heart, kidney only. S6 minimum electricity is enough for the hyperfunction of the heart.
Okay.
Like just I think one examination example. For example, frequent urination. Frequent urination is in this case. Frequent urination. That was the particular case of this case. Frequent urination.
Yes, 2F1Y, Shankar sir.
Yes, this case now.
It is light dose or strong dose, sir?
Strong dose. You will tonify to spleen.
Yes, strong dose.
So, if you ask the protocol from any doctor, sir, there is a frequent urination. Okay, definitely they will say that frequent urination is the positive disease of the kidney, hyperfunction of the kidney, excess energy of the kidney. We accept this. This excess energy, this excess function of the kidney is because of which organ, sir? If we find out that organ and just be tonified to that particular organ, it will actually the strong medicine, tonification medicines have more good results in comparatively to the lighter or sedative medicine. Sometimes sedative medicines may be sleep, but tonification medicine never sleep. my personal experience. Just find out the organ, which organ is in deficiency, and simply treat to deficient organ. Because in all the chronic cases, you have time. In some acute cases, for example, extreme itching, extreme fever, or
Sir, I
sometimes.
want to ask you one thing, sir.
Yes.
I am Dr. B.S. Prasad.
Yes, sir.
I wanted to ask you, see, yesterday you recommended to take,
P2.
P2 one drop.
P2C5G lighter.
But he had taken that, and also application of,
G.
G at the center, right at the surrounding area.
Yeah.
I got good result.
Pardon?
Today pain is less.
Yes.
Sir, yesterday you gave one protocol for his abscess.
P2C5 and green electricity,
Yes.
RE
oral.
also, sir.
And RE outside of the
External
wood,
and internal.
and green electricity in the center of the wood.
But it worked better. But thing is, sir, from the afternoon onwards, I had loose motions.
You have
Loose motions, sir.
good motion. Yes.
I think it is elimination process.
Actually, liver is directly related with the metal, large intestine.
Yes.
So in the loose motion, the function of the large intestine is less.
Okay.
Function of the large intestine is hypo, because in the large intestine suck the water from the fecus. When he suck less water from the fecus in the hypo condition, that is the loose motion.
Okay.
In that condition, you can consume strong medicine for the large intestine or for the metal.
That is S10 and
That medicine is S10, P3, and WE.
WE. Shall I change the medicine now?
No, you can take alternatively.
And one more thing also I wanted to tell you. Usually I have, craving for sweets.
Pardon?
Usually I have craving for sweets.
Yes. Yeah.
And at the
Craving
same
of the
time,
sweet. Craving of the sweet is because your liver is hyper, na. That's why I give the medicine lighter, green electricity. Okay. So your liver is in hyper condition. Okay. That's why your spleen is hypo. Okay. And your body is requiring more sweet.
Okay.
Actually, there are two types of the treatment in the practice. One treatment is normal treatment for normal diseases. And the second treatment for the emergency cases, that treatment is aggressive treatment.
Okay.
So, in normal treatment, chronic treatment, typhoid, malaria, dengue, HIV, liver issues like that, in these cases, we try to follow out some authentic protocols. Okay. But in emergency cases, okay, we give aggressive treatment, and we forgot all the things and treat the aggressively. For example, your pus formation is the stagnation because of your liver hyperfunction. Okay. But in tuberculosis also there is pus formation. So if your liver is hyper, okay, in other case, in other normal case, I never touch to liver. Liver is controlled by the metal, that is the lungs and large intestine. So for other diseases in a liver axis condition, I treat with S10P3 WE. Okay, but it will take some time to control these things. Okay, but there is pus formation, pain, abscess. Okay, these conditions are emergency conditions. That's why I aggressively try to sedate the liver. Okay.
Okay.
That's why I choose liver medicine in lighter dilution.
Right now, sir, see, I'm also having one more symptom, that is frequent urination.
Actually, frequent urination is because you have the craving of sweet. Your spleen is slow. Okay. After treatment of this abscess, we will
Yes.
give some other protocols. Okay. Then your body will restore. But
But
now
I have a
our
lot of
first
itching on the skin, sir.
right now our first focus is on your abscess.
Okay.
In medical, we just suppress first the main problem which patient is complaining.
Okay.
We are finding and we are diagnosing that there are major problems in the body, but patient is complaining, sir, I have the pain only in this hand. First, we will reduce the pain, because if we did not reduce the pain and we think that we are working on the other organ and other organ is in very serious condition or danger condition, but patient will not understand these things. Patient want relief first on the pain condition or the complaints which we complaining. Okay, so if he is complaining the pain reducing, so first we will work on the pain. When the pain will reduce, patient feel that medicine is good and peacefully we will consume the medicine.
Sir, I have itching also, sir. Skin itching.
Skin itching. Yes, it will reduce automatically, gradually. Only 3 days. First, you take this treatment, and your abscess will be normal. Then we will change the protocol.
You want me to take lung tonification protocol along with
Yeah, already I advise you for lung tonification S10, P3, and WE.
yes.
Strong.
Okay, sir. Thank you very much.
Sir, so any clarification, any doubt, or any other question related to today class? Nanda sir, yes.
Very good suggestion. So don't have to go for sedation. Always go for tonification unless otherwise emergency.
Yes.
So if they come with a complaint, first address the complaint, then go for the regular tonification treatment. Otherwise, don't touch sedation.
Yeah.
That's a good point.
Sedation is always, actually, you can't suppress the things. In sedation, you are suppressing the thing. So accept this, and sometime if you try to sedate, sometime it may be aggravate.
Okay.
If you work on the sedation, sometime it may be aggravate. So
The patient will get more pain or something. It may happen the other.
Yes. So simply we have the way. Just find out the deficient organ and tonify.
Yeah. Okay.
Tonification is a good way.
Yeah. Good. Logically, we get the things how we arrive, but it may be very easy to arrive at a solution even by not checking pulse diagnosis. Just
Sure.
Get the taste from them to taste, and then we just go for it.
Actually,
It's very simple.
Taste is very strong symptoms.
Yeah.
In my daily practice, okay, we are observing that taste is, you can declare it 90% without any investigation on the behalf of taste craving or taste dislike. These both symptoms are very strong symptoms. Emotions may be confusing. Sensory organs may be confusing, but taste craving and taste dislike, these two symptoms are very strong symptoms.
Life is very easier now after hearing all these things. We can handle anything.
Yes. Vincent sir. You are mute, sir. Vincent, sir.
Sorry. Yeah.
Yes. Thank you.
So I have understood it very clearly. Even yesterday, when you talked about
Yes, sir.
yeah, yes, sir. Hello,
Yes, sir.
Yes.
am I audible, sir?
Yes, yes, sir.
So this tonifying is enhancing, increasing energy.
Yes.
So we'll have to see which is not functioning properly and what is the cause, and then tonify it.
25.
So then it saves the trouble of finding out which is what and symptoms, what are the symptoms.
Yes. Most commonly in cough protocol, knowingly or unknowingly, what we are doing. Most probably in the cough protocol, maximum number of doctors are using bureau electricity. Using the what they are doing, what bureau electricity is doing in lungs. The electricity is the white.
Yeah.
Just by using the bureau electricity, they are tonifying to deficient organ kidney. When you tonify to the kidney, automatically your lungs energy will disperse.
Right.
They are not
Right.
thinking about this way. They don't know why they are using in cough bureau electricity, but they are using.
They are using it. Yes.
They are using only. They don't know why they are using.
Without knowingly or unknowingly, that
Yeah, actually, if medicine is working, means the composition is correct.
right. That
And
is how we go by that.
yes, when medicine will go in the inside the body, it will work. Knowingly or unknowingly, what you are doing, knowingly or unknowingly, they are just following the formulation or protocols by receiving the seniors, and they never describe the logic behind this.
Without knowing anything, without the reason.
Yeah.
It's been done because it is there, as in the form.
And
Now we are getting here. Thank you.
thank you. And thank you, Dr. Amina, for joining we Indians. Amina. Dr. Amina. Actually, we are going to organize a separate class for the Nigerian persons because time issues. I think how much? 4 hours difference. Yeah, 4.5 hour difference in Indian and Nigerian time. So they want some different time. They want time after 11 p.m. We will arrange separate classes for them. Shankar,
Sir,
yes, you have any query?
no, sir. Today, I learned as a good information from your side. That is tonification, very organ. So really, I'm happy, very happy, sir.
Thank you.
Thank you very much.
Dr. Sharda,
Nothing, sir.
anything clear?
Yes, sir, clear.
I can ask question.
Thank you so much, sir.
I can ask question.
Yeah, sir.
Hmm?
Okay, sir.
Tell about your weakness.
If any person dislike sweet,
Mm.
Dislike
Spleen
of the
is
fluid.
hyper.
Spleen is
Hyper.
hyper. Okay. According to you, what treatment should be?
Control.
Controller
Yes. Which organ is the controller organ?
Wood.
wood.
25 wood.
25 liver.
25 to liver. Okay.
Yes, sir.
So, symptoms of hyperfunction of spleen. One symptoms.
Hyper frequent urination, mouth ulcers.
Hyperfunction, no frequent urination. In hyperfunction,
That is
less urination. And in hyperfunction, frequent urination. Yes, mouth ulcer is okay. Mouth ulcer is the symptoms of hyperfunction of spleen.
Okay.
And dry mouth
Hmm.
is the symptoms of hyperfunction of spleen.
Okay.
Today, I will send you the soft copy of this notes on WhatsApp group.
Okay, sir.
So it will be helpful.
recording.
Recording.
The recording already I am putting in group.
Okay, sir.
All the recordings are available on my YouTube channel.
Okay, sir.
Okay. Daily I am putting the link in group.
Sir, could you please tell that channel name, sir?
Already, madam, I put two, three links in this group. So this link is my channel group. Okay. So,
Okay.
you can go there and just subscribe. So when I will put, you will get notification. All Hindi class recording, English class recording, and my other small class recordings are available. Okay. So today recording, tomorrow record, yesterday recording, you can get from there.
Okay, sir. Okay.
That is subscribe one.
Nanda,
Sir?
in fact, in my office, I have a 3 foot by 5 foot 5-element chart. And every time a patient comes, I explain based upon the 5 elements. And on the chart, I have put out all these points, taste, craving, and everything else. So when I ask the patient the different questions, I am looking at the chart and explaining. So it becomes very easy. I suggest you also do that.
Yeah, well, surely. Yes.
Actually,
No. We can give a questionnaire to the patient.
yes.
Yes, we have a ready format.
In the end of the class, we will provide you. Otherwise, today I will put in this questionnaire in the group. Okay. And you can practice.
Sir, can you give that YouTube channel link, sir? Yours.
Already, you all have, na? Asri,
Sir?
already you all have, na?
No, sir. Waiting for only daily links, but yesterday
Daily,
and
sir, daily link is the that YouTube channel link, na? Otherwise, separately, I will put this link in group. No problem.
please, sir. Thank you.
Today, Nambi sir has disappeared.
Yes. This is our my screen is visible.
Yeah.
This is the page number 2 of this questionnaire. Okay. by using this questionnaire, you can easily make this like this patient case study. After the end of this class, last two classes, we will explain this and we will practice it. We will practice this exercise. Okay, how to take this case study: sense organ test, flute test, craving, sound, quality, odor, emotion, nature, and vertebra, tissues, color, glands, complaints, season, and personality, body type, reason, organ, and organ energy, like that. Okay, so no problem. Today I will put this case study in the group. Okay, sir. Thank you.
Hello, sir.
Thanks a lot.
Thank you, sir.
Thanks a lot.
Thank you, sir.
Thank you, sir.
Good night, sir.
Right. Night.
Sir, one more case sheet also put that, sir.
Yes. Case sheet I will put in group, and soft copy of the notes which we will provide in you in a hard copy. But just now I will put the soft copy. Okay, and we will post all the hard copy on your address by speed.
Thank you, sir.
Thank you.
Thank you, sir.
Good night.
Thank you, sir.
Good question.